that cardiac cycle, it is nothing but events at the level of ventricle. Events at the level of ventricles. So when we are discussing cardiac cycle, we are least interested at the level of atrium. Obviously the atrium will go for contraction and relaxation, but we are mainly looking at the level of ventricle. So it is the ventricular events, right? Now we all know that both the atrium forms a separate syncytial tissue and both the ventricle also forms a separate syncytial tissue. So whatever is happening in the right ventricle, the same thing is going to happen on the left ventricle, right? Means both the ventricle is going to cause contraction simultaneously. But there is a little difference which you have to remember for your MCQ purpose, that is the contraction of left ventricle start earlier than right ventricle, very little earlier, although I am saying that both of them are syncytial tissue, but because the depolarization is occurring first in the left ventricle, the contraction of the left ventricle will also start a little bit earlier than that of the right ventricle. But if you look at the ejection of blood from ventricle, then right ventricle will start ejection a little earlier than that of the